Hey, I'm Dr. Seiler from Seiler Skin in Birmingham, Alabama, and we're going to shoot a short video today of a little bit of a lip augmentation with some Juvederm in Lindsay's lip here. Lindsay's one of my great staff members, and she's been wanting to do this for a while. She's never had it in her lips before. So in this video, you'll see me doing a quick little numbing shot, which makes this completely painless. You'll see that the numbing shot is very tolerable. Most people are afraid of it, but it's really no big deal at all if it's done by somebody that really does a lot of them. And we'll get her good and numb, and we're going to put just a little bit of filler to give her a little bit of a higher lip line on the outside so that she shows a little bit more of her lip. And a lot of people are afraid of doing lip filler because they think that their lips are going to be huge, and that's totally not true if it's done correctly. I can do a nice little augmentation of the lip and just make the lips a little bit fuller like they used to be without anybody thinking that you were filled. And I certainly don't ever give anybody the duck lip. So we're going to show how easy this is to do. For those of you that are interested, you'll see that this is a virtually painless procedure. So, all right, lean all the way back for me. Lindsay's not had this done, but she's assisted me on plenty of them. So, all right, close up for me. All right, just close all the way down. There you go. So we do just a tiny little numbing shot inside the mouth here, a little stick. This will get you good and numb, and the numbing only lasts for a couple hours, so it's really no big deal. One little stick right here makes this lip nice and numb, and then she won't feel anything. Is that okay? Mm-hmm. You feel much? Mm-hmm. Not bad?
No.
That'll kick in quick, make you really numb fast. Let's see if the camera can pick this up, but this is a really easy little numbing shot. Most places that do filler do not offer this because they don't know how to do it, and then the patient's really uncomfortable. This also has a little bit of medicine that helps to reduce your bleeding so that your bruising risk is minimal. All right, little stick. You okay? Mm-hmm. Feel that kicking in on the corners? Mm-hmm. Okay. All right, let's wipe her upper lip off real quick. We're going to get her lip prepped here. The other thing that we're going to use is a new tool that I have several videos on our website about called the AccuVein, and this is an awesome little, it's a tool that uses different wavelengths of light, including a laser, that helps to show the little vessels on the skin, and it really helps me to miss any little vessels that could bleed and cause a little bit of bruising. So we did a liquid facelift earlier today, and the patient didn't have a drop of blood after we were done, and we injected her all over her face. So this is a great little tool that y'all good and numb?
Yeah.
Good. All right, lean back for me. Let's get this side wiped off real good. Usually you don't have many vessels in the lip that cause a problem, but you can see that she's got just a couple right on her little lip line that we need to avoid. Okay. Alright, so we're just going to test her here and make sure she's good and numb. Let me know if you feel anything. Does that feel sharp? Mm-mm. You feel it up there? Mm-hmm. Right there? How about out here? Mm-mm. Alright, so when we get to this injection right there, if you feel anything, let me know. We can put a little more numbing in.
Okay.
By the time we get there, though, it should catch up. Alright, Lee's going to ice her for just a second. So we do a little bit of icing before to help to not only further numb the lip, but to minimize the bruising risk. You can also see that Miss Lindsay has the longest eyelashes you have ever seen.
Let's get a close-up.
Alright, that should be good. Alright, let me know if you feel anything. You'll feel a little pressure, but it shouldn't be sharp. So basically what we want to do in her is she's lost a little bit of kind of the line to her lip, and her lip has just started to kind of roll in a little bit. Even though she's in her 20s, she's still kind of losing that volume a little bit. So what we're going to do is we're going to start on the outside right here. We'll stick. Okay? Mm-hmm. You feel anything? Mm-mm. Just barely? Mm-hmm. We're going to do a little bit of filler right here. And Lindsay's before and after pictures will be on our website soon. It usually takes a good 4 weeks for this to really kind of settle in and give you the volume that you want. And because we use that little tool, you can see she didn't bleed at all. Open just a little bit for me. I'm going to kind of just massage here. Make sure this fits in really good. The goal of this is to give her a nice little augmentation without making it look like we did it. Just kind of give her a little bit of volume back. I also take my time with this. Most people that do injections do this way too fast, and then the patient bruises, and all they remember is the bruising. Hope you can get it for me. I'll do a little bit of massage here. So we'll go through the rest of her lip. We try to keep these videos kind of short, but we'll kind of stop here in just a minute, and you'll be able to see her before and after pictures. But the main thing I really wanted to get across on this video is that this does not have to be a painless procedure that makes you bruise and makes you look funny. We can do a nice little augmentation of the lip without the patient having any downtime or any discomfort, and you barely even feel the little numbing shot. And you can see that she's already gotten a little bit better volume and roll out there. I'll start right here. And you feeling anything right there? Good. So now you're good and numb right there. I'm going to do just a little bit filler right here. Lindsay's got a really good Cupid's bow, which is the little U to the lip, the little perk right there. You can see that all that's really good in her, so we're not going to really do much filler right there. But so I'm going to hold a little pressure here to make sure she doesn't have any bruising and everything, and then we'll have her before and after pictures on our website. And if you're interested in filler, you can come see us for a consult, and we'll talk about the different options. And so this is a little bit of lip filler, and thanks for watching.